Hi, I'm Shaun Fix for EMS World, and we're going to talk about some universal precautions for safety. Universal precautions for safety is a concept that I put together to help us in understanding what scenes may be violent, what scenes may have a potential for violence, and what scenes are not violent, but we want to be ready for them just in case. We certainly understand that most scenes are not violent, most patients are not out to get us, most calls we go to are not going to injure us. But just like wearing gloves, what we used to call universal precautions, or now we call standard precautions, I like to put that in safety. So that we're always thinking about understanding how we're going to act or how we're going to react should we run into a situation requiring us to leave the scene, requiring us to not enter a scene, or requiring us to have to hastily retreat from somebody or something that's liable to injure us. One of the first concepts that we talk about in universal precautions for safety is arriving at the scene. Arriving at the scene incorporates driving safely, driving appropriately, controlling our emotions, and not letting the siren invite or incite a crowd. One of the things that I say is, when it's safe, try to arrive without lights and sirens blaring so that we don't have a number of onlookers coming out to see us. In certain areas, inviting that crowd causes an increase for safety issues, especially when we're talking about areas, what I call the social arenas, areas with lots of alcohol, areas with potential drug use, areas with a lot of people that may now create a both scene hazard and possibly a safety hazard for us as well. As we arrive at a single-family residence, we should steal some things from the fire service. In the fire service, we teach firefighters and fire trucks and fire officers to pull just past the house so they can see three sides of the house. On the universal precautions for safety, I like this because it does several things. Number one, it's a little bit different than what those people inside the house expect you to do. They expect you to pull up to the driveway, walk up the driveway, walk up to the walkway directly to the front door. In pulling just past the house, you're a little bit off track of where they're expecting you. So in theory, if somebody was looking to injure the responders, they're not going to see you as readily as if you had just walked straight up to the door. The other thing this does is it allows you to see each side of the house. Is there anything on the front side of the house? Anything on the first side you see, or what we would call side D? Anything on the far side of the house, or what we would call side B? Are there people there? Are there exits there? Is there a hazard there? This allows us to view that before we arrive. As we walk up to the house, things that we should think about are, number one, and most important to me, is listen to what's going on. If you're walking up to a person who's supposed to be just ill and you hear screaming or glass breaking or something of that nature, this could create a hazard, or this could lead you to believe that there might be something different than somebody who's just ill inside. If we stay several feet apart, that allows you the ability to see and hear things away from your partner. You should also keep your radio turned down as much as possible. You still want to be able to hear it, but you just don't want the radio to be very loud. As you knock at the door, what we say is knock from the knob side of the door. That is the side that the door would open from. Knocking from the knob side, number one, keeps you out of the direct path if somebody is running through the door to get out, or if somebody is just panicked and opening the door to try and grab you to come in because they're concerned about what's going on inside. Being on the knob side of the door also allows you to see inside of the residence or inside of the building you're entering better than if you're on the hinge side of the door. As you enter the residence, what you need to do is look around. Law enforcement calls the door area the fatal funnel. That is a funnel shape from inside of the house to the front door where everybody inside is able to see you, and you've got to look around the whole house to see what's going on. They tell us don't stay in that funnel area. Don't block the pathway for somebody to get out if they want to get out and get away from you. Also, don't block the pathway with yourself or your equipment in case you or your partners need to make a hasty retreat. The other thing Universal Precautions for Safety tells us is as you go into any residence or any building, immediately look around, casually, but look around the scene. Look around for safety issues, for potential hazards, for extra people, but also look for emergency exits. That is, an exit if something went bad in the house that you could get to if your main exit was blocked, whether it's a window, another door, or a hallway. Always look for those on every scene. So this couple-minute section was to remind you, really, not that you need to climb into every call as if somebody's trying to shoot at you or somebody's going to throw a stick at you or beat you up, but you should have situational awareness. Just like universal precautions with wearing gloves or using our other safety protective measures on every patient in case they had some type of disease, Universal Precautions for Safety tells us being prepared of the violence potential or the safety potential on every scene, so that if something happens, you're able to think a little bit quicker and just have situational awareness. I'm Shaun Fix for EMS World. Thanks for watching.